Welcome, dear viewers of Health Hub. In modern life, lifespan is increasing, but are we truly living healthier lives? A concerning health issue is silently affecting millions of older adults worldwide: obesity. More than just a change in appearance. Obesity in older adults is a silent enemy, causing countless serious consequences, reducing quality of life and shortening lifespan. Another study in the United States, September 2024, showed that the obesity rate in adults aged 60 and older is 39.6%, and the rate of overweight and obesity in older adults is alarmingly increasing. So, what is happening to our bodies as we age and our weight increases accordingly? Let's explore this issue in more depth with Health Hub right now. Obesity in older adults is not a random occurrence. It is the result of a complex interplay between many biological, lifestyle, and environmental factors. To understand it better, let's analyze each aspect together. The aging of metabolism, metabolic slowdown as we age. The basal metabolic rate, BMR, naturally slows down. BMR is the amount of calories the body burns at rest to maintain essential life functions such as breathing, blood circulation, and maintaining body temperature. This decline means the body needs less energy to function, and if calorie intake remains the same, the excess will be stored as fat. The disappearance of muscle, sarcopenia, or the loss of muscle mass and function, is a natural process that occurs as we age. Muscle is metabolically active tissue that helps burn calories efficiently. When muscle mass decreases, the body's ability to burn calories also decreases, creating favorable conditions for fat accumulation. Studies show that older adults can lose up to 1 to 2% of muscle mass per year after age 50. The freezing of physical activity, reduced physical activity. Many factors can cause older adults to be less active, including health problems such as joint pain, fatigue, chronic diseases, cardiovascular, respiratory, or simply due to a sedentary lifestyle. Lack of physical activity significantly reduces calorie expenditure, contributing to energy imbalance and causing obesity. Nutritional overload, nutritional imbalance. The diets of many older adults still maintain habits from their younger years, often tending to consume many high-calorie foods, saturated fats, sugar, and salt, but few green vegetables, fruits, and fiber. In addition, the uncontrolled use of nutritional supplements can also provide unnecessary excess calories. The influence of physiological and psychological factors. Changes in taste and smell in older adults can lead them to seek out richer foods with more sugar and salt to increase the sensation of flavor. Feelings of loneliness, boredom, and anxiety can also lead to overeating as a way to relieve emotions. The side effects of medication. Some medications commonly used by older adults, such as corticosteroids, antidepressants, certain diabetes and blood pressure medications, can cause weight gain as a side effect. Genetics and other factors. Genetic factors also play a certain role in determining a person's tendency to gain weight. In addition, factors such as living environment, stress levels, and sleep quality can also affect weight. Obesity is not simply a matter of weight, but also a trigger for a series of dangerous diseases, seriously affecting every organ system in the body of older adults. Let's together list the negative impacts that obesity brings. Musculoskeletal disorders. Excess body weight puts constant pressure on the joints, especially weight-bearing joints such as the knees, hips, and spine. This leads to osteoarthritis, cartilage wear, causing pain, stiffness, and limited mobility. The risk of osteoporosis and fractures also increases due to the weakening of the skeletal system. In addition, obesity increases the risk of gout, a type of arthritis caused by the accumulation of uric acid in the joints. Cardiovascular diseases. Obesity causes lipid metabolism disorders, leading to increased bad cholesterol, LDL, triglycerides, and decreased good cholesterol, HDL, causing atherosclerosis. Atherosclerotic plaques narrow the blood vessels, hindering blood circulation, leading to hypertension, stroke, myocardial infarction, and heart failure. The heart of an obese person has to work harder to pump blood throughout the body, eventually leading to weakened heart function. The mortality rate from cardiovascular diseases related to obesity is very high. Type 2 diabetes. Obesity is one of the leading risk factors for type 2 diabetes. Excess body fat reduces the sensitivity of cells to insulin, an important hormone that helps regulate blood sugar levels. This condition is called insulin resistance. When the body cannot use insulin effectively, blood sugar levels will rise, leading to diabetes with many dangerous complications such as nerve damage, blindness, kidney failure, and cardiovascular problems. Gastrointestinal disorders. Excess fat accumulated around the digestive organs can cause many problems such as constipation, indigestion, heartburn, and increase the risk of hemorrhoids. The accumulation of toxic waste in the intestines due to prolonged constipation can increase the risk of colon cancer. Obesity is also a major cause of non-alcoholic fatty liver disease, NAFLD, a condition in which too much fat accumulates in the liver. If left untreated, NAFLD can progress to non-alcoholic steatohepatitis, NASH, cirrhosis, and even liver cancer. Disorders of fat metabolism also increase the risk of developing gallstones. Cognitive decline and dementia. Research increasingly proves the link between obesity and cognitive decline in older adults, including an increased risk of Alzheimer's disease and other forms of dementia. Factors such as chronic inflammation, blood vessel disorders, and the accumulation of abnormal proteins in the brain may be the cause. Respiratory problems. Excess fat in the neck and chest area can compress the airways, causing loud snoring and sleep apnea. This not only reduces sleep quality but also increases the risk of cardiovascular diseases, high blood pressure, and stroke. The activity of the diaphragm and lungs is also limited, leading to shortness of breath and reduced exercise tolerance. Reduced lifespan. Many scientific studies have shown that obesity significantly reduces the lifespan of older adults by an average of 6 to 8 years. This is due to the increased risk of chronic diseases and dangerous complications. Endocrine disorders. Obesity can cause hormonal imbalances in the body, affecting many important functions. In women, obesity can lead to menstrual disorders, polycystic ovary syndrome, and an increased risk of infertility. In men, obesity can cause decreased sexual function and reduced sperm quality. Increased risk of certain cancers. Studies have found a link between obesity and an increased risk of certain cancers, including esophageal, colorectal, breast, in postmenopausal women, uterine, liver, biliary tract, and prostate cancer. Potential mechanisms include chronic inflammation, hormonal dysregulation, and abnormal cell growth. Although obesity in older adults poses many risks, the good news is that we can completely control and prevent this condition through positive lifestyle changes. Here are the important keys that Health Hub wants to share. Building a healthy diet. Prioritize whole foods. Focus on green vegetables, fresh fruits, whole grains, brown rice, oats, beans, and nuts. Supplement lean protein. Choose healthy protein sources such as fish, skinless poultry, eggs, and tofu. Limit unhealthy fats. Stay away from fried foods, fast food, processed foods containing a lot of saturated and trans fats. Reduce sugar and salt. Limit sweets, sugary drinks, cakes, candies, and foods containing a lot of salt. Control portion sizes. Eat just enough. Avoid overeating, and divide meals into smaller portions throughout the day. Drink enough water. Ensure you provide enough water for your body every day. Seek advice from a nutritionist to have a personalized eating plan suitable for your health condition and preferences. Igniting the passion for exercise. Choose suitable forms of exercise: walking, brisk walking, swimming, cycling, tai chi, gentle yoga are good options for older adults. Exercise regularly. Try to spend at least 30 minutes each day on moderate physical activities. Listen to your body. Start slowly and gradually increase the intensity and duration of exercise. Encourage daily activities. Take the stairs instead of the elevator. Walk to the nearby store instead of driving. Monitor weight regularly. Weight and BMI are important indicators for tracking weight control progress. Check your weight periodically and record it to monitor changes. Collaborate with your doctor. Visit your doctor regularly for an overall health assessment and to receive appropriate advice on weight management. Your doctor can help you set reasonable weight goals and provide recommendations on lifestyle and treatment if necessary. Obesity in older adults is not a sentence, but a reminder of the importance of proactive health care. By making small but persistent changes in diet and lifestyle, older adults can completely control their weight, reduce the risk of disease, and enjoy a healthy and happy old age. Remember that the journey of healthcare is a continuous process, and Health Hub is always with you on this journey. If you found this video helpful, don't hesitate to press the like button, share this video with your loved ones, and subscribe to the Health Hub channel to stay updated on the latest and most useful health information.